Hello, everyone. I'd like to welcome you all today to our live event. My name is Linda Cove. I'm a public health nurse on the mental health team with Ottawa Public Health. And we're very excited today to have Dr. Raj Bhatla with us. Dr. Bhatla is the Psychiatrist-in-Chief and Chief of Staff at the Royal Ottawa Healthcare Group. He's also the Vice Chairperson of the Consent and Capacity Board of Ontario and is a member of the editorial committee of the Journal of Ethics in Mental Health. As well, locally, Dr. Bhatla co-chairs Suicide Prevention Ottawa, a network of 40+ partners working together to prevent suicides. I'd just like to let our viewers today know that we will not be taking questions online due to our time constraints. But if you do have a question, you are invited to look on the Royals website. They do have an FAQ section, which you can submit questions to and see what questions other people have submitted and which ones have been answered. And so have a check of their website. We are also recording this event, so it will be on our Ottawa Public Health YouTube channel. Before I pass things over to Dr. Bhatla, I'd like to acknowledge that Ottawa is built on unceded Anishinaabe territory. The people of the Algonquin Anishinaabe Nation have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this place. We honor the people and the land of the Algonquin Anishinaabe Nation. And now over to you, Dr. Bhatla. You might still be on mute, Dr. Bhatla.
Apologies. Yeah. So thank you very much, Linda. Always a pleasure to work with public health. They do a great job. You do a great job in reaching out to the public and working with a variety of partners for the benefit of our citizens. So it's always a pleasure to do anything collaboratively with you. So today we'll be talking a little bit about wellness, and in particularly wellness during the pandemic. So I'm going to give a little context and then share a screen shortly about what's happened during the pandemic to our mental health and wellness in general. I'll talk a little bit about wellness in general, but focusing on the pandemic, and give a few little tips and tricks on what we can do to be well during, frankly, pretty difficult times. So I will move on to that, but just a little bit before, I will share some of my learnings over the past while come from my clinical work at the Operational Stress Injury Clinic here at the Royal, where we partner with Veterans Affairs Canada. And a lot of my clinical work now is really with veterans, with RCMP, and with individuals transferring from the forces of national defense and becoming veterans. So that is a lot of my clinical work and a lot of where my thinking comes from these days with respect to wellness. So I will just try to share my screen now. Should work just fine. And hopefully you can see that now. I'll just try to get rid of, there you go. So that is the topic in general, and I'll start moving right away. So first of all, what is the evidence? I don't think it's news to anyone that in particular, over the past while through the pandemic, we have had growing issues in the population with anxiety, with depression, and importantly, with substance use. We do have at our Institute of Mental Health Research here at the Royal, Dr. Rebecca Robillard, who is partnering with other institutions. And we've done a good survey as to what's happened to the population, both the population that already suffers from mental health and addiction issues, but also the general population. And it's very clear that the numbers have grown with respect to all three of the major issues as described in this slide. So wanted to thank her for doing the research. And it's probably not all that surprising to anyone that we know the data from LCBO. We've had increased use of alcohol, still the most prominent substance of use. And we hear in the news a lot about opioid overdoses and opioid deaths, which has really taken a toll on some of our most vulnerable. I'm going to move a little bit now on to signs and symptoms. And I want to really emphasize before going down the slide that, a lot of people aren't feeling particularly great about things. That part is normal. So when I'm talking about signs and symptoms, I'm really referring to changes that might require a bit more help and maybe guidance to more supports. It's pretty normal not to feel perfectly well these days. That's fine. A phrase we use a lot is it's normal to not feel normal. The other thing, though, is some people have actually done okay through the pandemic. And if you're feeling okay, that's all right, too. There's no reason to feel bad that you're doing okay. But to the slide, the things we look for when we're thinking of changes in mental health that might require more formal types of treatment are changes in the usual patterns of thinking and the usual patterns of behavior. So you know yourself best, and you know the ones that are close to you well. So when there are those changes that are significant, that's the time to really consider seeking out more formal avenues of support. And I think, Linda, you'll be describing some of those options later, and I'll be doing a little bit as well during the latter part of this presentation. The next point is the excessive anxiety. And I do want to be quite cautious there in emphasizing that anxiety has become pretty standard, so to speak. So anxieties that are fairly normal for the pandemic in terms of worrying about getting COVID, worrying about loved ones, that is pretty normal. What I'm referring to is the excessive anxiety that makes one less functional, less able to manage their needs, their work, their obligations. So when there's excessive anxiety, that might be an opportunity to really seek out more help. The third one I have on the slide is the prolonged, and I stress the word prolonged, sadness and depression. Many people have felt sad during the pandemic, more so than usual, and always tough to figure out the word sadness versus depression. Whatever term you use, if it's prolonged and seems to be more persistent, that's also an indication that it might be best to reach out for more formal supports and evaluation. The third one, actually the fourth one, excessive. And again, I stress the excessive. A lot of people during the pandemic have been more irritable than usual. A patient of mine yesterday described himself as having cabin fever, a term that I'd actually forgotten, but a term that's commonly used. And he was really describing some of the irritability he gets. And certainly that irritability can move towards anger, which is a major issue then. The next point, mood swings, especially for people who don't normally have mood swings. If you start to see someone around you, or if you notice yourself that you're having mood swings, that's something that often could use a more formal assessment and evaluation. The next, which I've already alluded to, become very common. Alcohol remains the most important substance of misuse, overuse. Important to keep an eye on the alcohol consumption. It tends to creep up on people. So be cautious yourself and keep an eye on that, but also for those around you. The other ones, of course, the opioids are being used more, cocaine and other things, but I'd focus on alcohol. The last couple are particularly important and may not necessarily really be a major indication of needing more formalized help. Have noticed during the pandemic with a lot of my patients that there's a certain amount of either apathy or lack of motivation to get things done. And people have complained about, I'm not as productive as I used to be, especially if you're doing things like working from home. You'd expect perhaps to be more able to get things done. You're not traveling as much, and you had projects that you might wanted to do either at work or at home, and they're just not getting done. And that seems to be a pretty common phenomena during the pandemic. And I wouldn't be losing sleep, so to speak, but if it becomes problematic and really starts impacting things that should be done, maybe something that needs an evaluation. But I'd be cautious in getting too self-critical if you're not quite having the motivation to do what you thought you might do and get done. So I'll move on a little bit to what you can do, especially for individuals who seem to be just having a tough time coping through the pandemic. Maybe not requiring formalized support, formal assessments and treatment, but just really struggling through the various problems of the pandemic. And some of the things you can do is truly listen. And, you know, we talk about listening a lot, but we don't always spend the time to really listen to someone when they want to talk. I've always said to my patients and some colleagues, and I remind myself, probably not the moment to do it as I'm on a soliloquy here, but we have one mouth and two ears, and we should more often use our communications in that proportion. So listening, really important. Next thing is actually just to simply ask, and asking someone how they're doing, especially those around you that you know, can be very powerful and allows them to just give you some insights as to how they're doing, how they're feeling, so that they can feel heard, and you get to use the listening skills that hopefully are being developed through the past while. Third thing is just the general support. Supporting someone, listening to them, and making sure they know that you're there for them and able to listen to their concerns and worries can be extremely important. When people are struggling, also important to connect them to others. And we'll hear a little bit more about that later on, but important to connect people to services they may need. Such as crisis lines, family physicians, nurse practitioners, therapists, and in some cases, things like the emergency room, should it really be needed. My last bullet is that there are a lot of resources on Suicide Prevention Ottawa's website, and I'd encourage people who want to learn a little bit more on how to support individuals, how to help connect, how to listen. You'll find some good resources on that website and other websites, but I'd encourage people to have a peek at Suicide Prevention Ottawa. So I'm going to move on now to some of the basic wellness things that are important for everyone. I will later talk about things more specific to the pandemic and then life wellness in general. But I'll start off with the sort of basic wellness concepts. And the big three that we hear a lot about are sleep, exercise, and diet. And maybe a touch controversial, but I think they kind of go in that order, especially if you're able to take care of your sleep and keep that in a routine, a regular bedtime, a regular wake up time, ease up on the caffeine in the evening, and the general things you can do to make sure you get enough sleep can be extremely important for your wellness. The other thing that people talk a lot about is easy does it on the screen time. A lot of people suggest actually that to stop the screen time and listening to the news after a certain time, 6 p.m., 8 p.m., because rarely do you hear anything really great coming out of the news cycle late at night, nor is surfing late at night particularly helpful. So there are a lot of things you can do in terms of researching the sleep. There's good information at the website at the Royal, and other good places where you can learn more about sleep hygiene, but something that's absolutely crucial and a part of your, what I refer to as basic wellness. The second one is exercise, and that's been challenging for many people during the pandemic. We now have a stay-at-home order, of course, and important to recognize that stay at home, but also it doesn't mean get out for the appropriate exercise. Always, of course, follow the guidelines being set out by the province and Ottawa's public health, but exercise certainly has not been banned and something that's very much encouraged. Good for your physical health, good for your mental health as well. So important also to get a bit of a routine when it comes to exercise. The last one is diet. And I think people have to be particularly mindful of keeping a balanced diet and watch out for those late night meals, comfort type food, carbohydrates, and just keep yourself well when it comes to the diet. Again, a lot of good information on diet through various websites, so I'm not going to spend very much time on that, but an important element of the basic wellness. So the big three, sleep, exercise, and diet, crucially important, and actually are the foundation to other aspects of wellness that I'll refer to next. So the next one, a little bit more on wellness during the pandemic. And this has been a bit of a challenge for a lot of people in a variety of ways that are somewhat unique to the pandemic. And I'll start off with the first bullet, and that is gaining control of your environment. And human beings in general like to, as much as possible, control their environment, their family life, their personal life, their work life, their social life, and they like to have a certain amount of say in various aspects of their lives. The pandemic, however, has really made that particularly difficult. Work lives have certainly been affected. We do know that social gathering, social connectedness has been very problematic and relatively unique to the pandemic. So we've lost control in many aspects of our lives. So very important to, as much as possible, regain some type of control over the things you can control. And some of those things are having that regular routine that I referred to previously. Regular routine in terms of sleep, a regular routine in terms of exercise, of diet, are extremely important and difficult to achieve. A regular routine for yourself is important, but also helps those around you. If you have kids in particular, their routines are disrupted, and particularly important for them to have as much of a regular routine as possible. So as much as possible, try to establish them and stick to them. The third one is self-care, which is important at all times, but I think even more so with the pandemic. So some of the things I referred to in the previous slide in terms of basic wellness are, if anything, even more important during the pandemic to keep yourself well. The fourth point I'd like to bring forward is actually the care of others. So the pandemic has really highlighted the importance of reaching out to others. We all know the tragedy in our long-term care facilities through both our community and actually internationally. And making sure we're reaching out to the vulnerable can be extremely important. The social connectedness especially important for those who live alone and may be struggling. And I would want to point out that care of others is not all that different from self-care. So I notice in a lot of my patients, especially the veterans, feel a sense of worth and feel better about themselves as they are called upon to perhaps take care of the family, take care of the environment and their work lives, and make sure that they're there, especially for their family. It's interesting for my patients. They really have a history of being there to serve and protect. And by serving and protecting what they can in their environment during the pandemic, it is very much for them a form of self-care. So I really don't want to separate self-care and care of others as distinct things. The last thing, which I've alluded to several times, is taking care of substances and making sure they're not being overused, which is quite problematic. One slide I wanted to highlight a little bit. Often people have heard this saying. People know it as the Serenity Prayer and used in 12-step programs. And I'll just read it out. Grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. So when it comes to controlling your environment, also understanding the things you can't control is very important. Last slide when it comes to wellness is, I think, important not only for the pandemic, but well beyond. And that's compassion. And I think I've seen a lot of compassion through the pandemic, and actually living a life of compassion for others as well as yourself. And as I've alluded to, those things are intertwined, can be very powerful in terms of one's wellness, pandemic and well beyond. Second, really important thing for most people is having a life of meaning and filled with acts of meaning. You have to decide what's meaningful in your own life, and if you can act on that and keep the meaning of life front and center as you move through the various stages of life, can be very powerful in terms of being well. Lastly is a life of gratitude, really understanding the things that you can be grateful for, even when times are tough, can be a very powerful form of both wellness and resilience. We did something at Suicide Prevention Ottawa, and that was to look for at least one good thing each day. And that's a bit of a catching thing. When you look for one good thing, often there's more than one good thing. And when you do that, others notice you do that, and they look for that nugget of good things that happen through the day. And I did borrow something from the website at Suicide Prevention Ottawa, and we had put up one good thing. I just borrowed that straight from the website. And the one good thing could be something good you do for yourself, something good you do for someone else, or something you actually experience. So have a look on the website and you might find more stuff of interest. The last slide is, I'd be remiss not to point out that there are a variety of apps out there. There are a few there on your screen. There are many others. Feel free to find an app and pick one that works for you and stay with it. Really important not to migrate between all sorts of apps. And lastly, there are a variety of devices that can be very helpful to monitor things like exercise, sleep, and even diet if you input the information. There's the Apple Watch, Fitbit, and many other devices can be extremely helpful. And I think with that, I'm going to stop my part of the presentation, as there's further information of where you can get help.
Thank you so much, Dr. Bhatla. We really appreciate all your helpful tips. And I'm sure our viewers as well will benefit from those also. I am going to share some information with you. I'll just find my screen and share some information about community resources that are available for all of us within our community. Hopefully you can see that now. Dr. Bhatla brought up some good points about listening and reaching out to others. And it's important that you know where to support people, how to support them, and where people can go if they do need help during the pandemic or at any time for that matter. So we're lucky in Ottawa. We have a number of free resources available to us. The mental health crisis line, of course, the distress center, and Telaid Utaway for the Francophone community are always available 24 hours if you want to talk to someone who will listen. That's one of their main roles, and also to help people through crisis situations. As Dr. Bhatla mentioned, you can always go to an emergency room at a local hospital as well if you're having a serious mental health crisis or know someone who is. And of course, you can talk to someone at one of the crisis support lines also to access help. I want to mention that these resources are on our website and will be in the information description below. So don't feel you need to write them all down. These will all be available, and you have easy access to these on the Royals website and on Ottawa Public Health's website. We also have crisis support lines for different age groups. So if you are a parent or you know a youth who is struggling, we have the Youth Services Bureau, which has 24-hour crisis line as well. The Kids Helpline, which is a national organization that you can call or chat with at any time. And Good to Talk for post-secondary students out there or parents of post-secondary students. There's a special crisis line for them as well. We are very fortunate to have the walk-in counseling clinics available in Ottawa and surrounding area. This is a counseling service that's offered to people for free. They have services in a variety of languages and a centralized phone number now that you can call. You see at the bottom of the screen where you can call and receive some counseling, and there's no wait list, no referral necessary. We also have in our city Counseling Connect, which is the result of 14 agencies, community agencies that came together to provide counseling services. There's a centralized website and a centralized access system now available to free counseling. So you can check them out at counselingconnect.org. And you will be helped. They have counseling related to substance use, gambling, a number of different topics, as well as for mental health. So definitely check out Counseling Connect. The Royal has the Royal Prompt Clinic, it's called, which is relatively new. This is a service that does require a referral from your family doctor, family healthcare practitioner, but that is offering specialized services for people with worsening mental health conditions where they may need an assessment or a change in medication, that kind of thing. So you can check that out as well. We have a variety of community services, as I mentioned, Youth Services Bureau, but there's also a couple for parents and children, Crossroads, one primarily for children's mental health that specializes in that field, and PLEO, the Parents Lifeline of Eastern Ontario, where parents can get support and families can get support. Of course, Rita Wood, Addiction and Family Services, and LeCap, which is an equivalent for the Francophone community, offers great services around mental health and addictions. All of this can be found on our website at ottawapublichealth.ca/COVID mental health. We've developed a number of resources in collaboration with the Royal, as well as videos. And there's a complete listing of all the community services and community resources that I just spoke about. So I noticed we are just slightly over time. I'd like to take this opportunity to thank you for joining us, to thank Dr. Bhatla for joining us and sharing his tips. And I want to remind you that the sooner you reach out for help, the better the outcome. So please take advantage of the services that are available. Thank you, everyone, and have a great day.